Well, give us a little insight into this budget balancing bill. You protected K-12 from direct budget cuts, is that right?
That's correct, yes.
And you protected Minnesotans most in need, and you adopted 2 major job bills. Is that pretty much sum and substance of what went on relative to budget balancing?
Yes, you know, we knew early on, right out of the gates, that our focus was going to have to be on jobs. You know, clearly the economy has not recovered, and we felt it was very important that we would do all that we could to try to stimulate the economy, given in our capacity at the legislature. But we also had a budget to balance. That was a huge challenge. And we were dealing with a large part of the session with the GAMC, the cuts in healthcare that affect the most vulnerable. So it was a matter of trying to close that budget gap, keep our priorities of looking at what we could do for job creation and job growth, protecting the most vulnerable, and the high priority for everybody there, the governor and the legislature, protecting our schools as best we could.
Let's talk just briefly about GAMC. Passed overwhelmingly in the legislature. Governor vetoed it. Republicans, on a party line basis, upheld the governor's veto.
Correct.
What eventually came out of the process?
Well, there was a compromise version that ultimately was passed by the legislature and signed into law by the governor. It became pretty clear very soon that the hospitals were not happy, or that the fix, as it was known as, the GAMC fix, was really not going to be a workable solution for many of our hospitals. Indeed, I think only 4 of the hospitals opted in to the program that we ultimately passed into law.
What's the upshot if only 4 hospitals have opted into the program?
Well, the concern is that people are going to have to travel very long distances in greater Minnesota to try to find a hospital that's going to be able to provide care for them, and we are concerned about, you know, uncompensated care as well. There was an option with the passing of the federal legislation, the federal health care law that passed. We had the option, as we were one of the states that was given the option to, they refer to it as early enrollment into medical assistance. And that would really alleviate a lot of our problems. The hospitals would have alleviated a lot of our problems, would have given a greater reimbursement rate to the hospitals, a better coverage for the patients. We would, however, had needed to invest an additional amount of money, which the governor was not able to come up with.
Sounds like a no-brainer. Why wouldn't we? I mean, wasn't it paying back on like a 7-to-1 basis?
Yes, yes.
I mean, no-brainer.
Yeah.
What am I missing here?
Well, I think it was the fact that it did cost. It was going to have an initial upfront cost for the state, and there was a feeling that in the short term, that was not possible. You say no-brainer, you know, that means that you have long-term thinking.
That means that you have a brain?
And that always doesn't happen at the legislature, unfortunately.
What other bills of note came to the legislative session in your estimation?
Well, one that I authored, I can talk to you
that?
about. That was licensing for birth centers. Have you heard much about that?
No, can you explain that, please?
Birth centers are places where women can give birth outside of a hospital. It's a freestanding center. And they are in place across the country. We have several in our state that are not licensed. We wanted to license them. And why we wanted to do that is Did
they want to be licensed?
Yes, actually they did. And they worked with me. They're really an important part of healthcare reform, I believe. The research is out there that women who use these centers have good birth outcomes. We know that there's a wonderful program in Washington, D.C., and it becomes really a model of care for women, and particularly women, some of our younger women, our teenage moms, and it has had wonderful results. And it lowers healthcare costs. And I think one of the reasons I was successful in getting this bill passed, and even though it's just a policy change, it's licensing of these facilities, was because it shows a cost savings for the state. It was introduced last year. Senator Berglund is a Senate author. And the physicians initially had some concerns with that. We worked with them, felt very strongly that we wanted the physicians on board. One of the good things I think that this bill did was something that we don't do very often as a legislature, and we said we want to kind of revisit the issue after a certain amount of time. We were going to have a group of people who would be interested interested OBGYN physicians, pediatricians, nurse midwives, ambulance drivers, hospital administrators to kind of look back and see how it is going. And that really makes for good legislation, I think.
Was there another bill of some note involving school trust lands?
You know, the school trust land bill didn't get all the way through, but you raise a really interesting topic. What that is when the state, with the adoption of the Minnesota Constitution, what was in there was something called the Federal Enabling Act. And it provided that granted that sections 16 and 36 of every township throughout the state would be set aside as school trust lands.
I didn't know that.
It's very interesting. And those lands would generate money that were supposed to go to the schools. Well, over the years, those lands have been sold off. The majority of them now exist in northern Minnesota. But what we have found, and what the legislative auditor found years ago, is that we really should be doing a better job at managing these lands. We can be generating more revenue. And it doesn't mean just clear cutting. That's not what it means. But we really should have a better management system so we can generate more revenue for the schools. We did some work on that issue last session, and the schools got an additional $33, I think, per pupil because of that. The DNR currently manages it. Ideally, we would have an independent manager of that and somebody who is really interested in maximizing the returns on that.
Okay. I want to switch gears if I can. And I've always been intrigued by the Bipartisan Small Business Caucus, for which I understand you are a co-founder. So
yes.
Give me a little bit of background on that, would you please?
We have a number of small businesses in our district, a number of entrepreneurs, and I often come in contact with them when I'm outdoor knocking. And you know, my husband is a small business owner. So years ago, people would be maybe a little, who would like to start a small business, would perhaps be reluctant to because they didn't want to walk away from a job where they had health benefits. Well, with the downturn in the economy, that has now, it's become really more of a necessity. People are starting small businesses because they were laid off from their job. And that really, they really are the economic engine of our state. So what we found in talking with my husband, who's a small business owner, with my seatmate, again, Representative Dietrich, we were starting to feel that, you know, we weren't sure this voice and the concerns that we were hearing from our constituents were being truly represented by anyone at the Capitol. And so we decided that we would start a small business caucus.
So this is a bipartisan?
Bipartisan, and we had a wonderful young intern who is a student at Cornell University, did a lot of background and research for us, and we had meetings throughout the session. We came up with several bills, I think 7 of the 8 of which were signed into law. So it was, you know, I would say very successful. The angel credit.
Tell me a little bit about
investment
that.
credit.
I've heard of it, but I'm not sure I understand
it. So an angel investment credit is when, you know, one of the things we heard about from small businesses was that startup capital is really hard to access, particularly now. And so when you have people out there who have money and would like to invest it, they want something in return, and because they're taking a risk with their money. And so we had developed the angel investment credit. A number of states have that. We have some other things in our state, but we didn't have that in our portfolio, and it was something that we succeeded in getting through, and that has looked upon as being a very positive thing.
So how has it worked in other states?
It's been good. It's, you know, investors look at that. That is definitely a draw for them. The Itasca project actually presented to the Small Business Caucus this week, and one of the things they pointed out was that we really need to be doing more things to encourage entrepreneurs, and so they pointed to the angel investment tax credit, which we think was a real plus. They presented to the Small Business Caucus and told us 3 things, and that was we really need to do a better job at addressing the cost of doing business in Minnesota. We do hear that from the governor on occasion.
Well, that's sort of an amorphous term. What does that mean?
Yeah, I think, you know, it's the taxes. It's kind of the tax climate for businesses, the regulatory climate for businesses. Yes, yes. So, I mean, that's something that we really should be looking at. The other thing that they talked about was that we really need to develop a vision and a strategy on a regional basis for our state. We really need to have somebody out there leading that and speaking to it, and then we need to be marketing it.
Now, is that regions within the state, like the Arrowhead District, for example?
Yes, that's a good thing for a governor to do, to be kind of out there and speaking to the virtues of our state and talking of, you know, different regions and their strengths.
Instead of running for president?
You know, it's important. It's important, the message that we put out there as a state, and that there is the impression that there's kind of a central, you know, location for people to go to. And so I thought that was a fair criticism and observation, and something that we can work on next year in the session.
Democratic Visions is produced by volunteers for DFL Senate District 42. Norbert Gurnis, Chair.